Welcome to the Healers Café, the #1 show for medical practitioners and holistic healers to have heart-to-heart conversations about their day-to-day lives while sharing their expertise for improving your health and wellness. Welcome to the Healers Café. And today I have with me Dr. Jeff KD Meyers. And he is a physician, an acupuncturist, a guide, and storyteller whose work bridges Western medicine, holistic healing, and expanded states of consciousness. A graduate of the University of Pennsylvania and University of Colorado School of Medicine, he completed residency training in physical medicine and rehabilitation at Penn and has practiced integrative medicine for over 30 years. Now, you specialize in peak performance, neuroplasticity, self-actualization, and fulfillment, leading seminars and retreats focused on innovative, integrative approaches. And you also teach internationally on topics including rehabilitation, resilience, yoga, Ayurveda, acupuncture, somatic practices, psychedelics, archetypes, and the transformative power of music. I think I'll leave it at that. He goes on. I think we're going to be talking again. But first of all, welcome. And maybe why don't you share with us what got you into this journey?
Thanks very much for that introduction, Manon. And I really appreciate it. And yes, it's been a pretty diverse journey. And it really started back, after college, where I had gone to the University of Pennsylvania. When I got out of college, I really didn't know what I wanted to do. And I was pretty involved in the arts at that time. And I started doing some traveling. And I ended up out west in Colorado and New Mexico, where there's a different consciousness out there, and ended up, you know, being really powerfully affected just by nature, primarily, and then also just that inspiration that nature brings and the looking inward. And I also was blessed to be, in Santa Fe, New Mexico, which had a very vibrant holistic community going on there, and interest in holistic medicine and holistic approaches to health and holistic modalities. And then I went up and spent time in Boulder, Colorado, which in a similar way, there's a lot of integrative medicine and integrative healthcare going on there. And it really had an impact on me. And so I started to do some experimenting as a very young man, changing my diet and starting to become exposed to different modalities. And like I said, I came from a creative background in college. And so I was looking for something where I could still pursue creative pursuits afterward. And I thought, okay, um, I can maybe go to massage school. And so that was a way for me to kind of integrate some of the interest in like going inward with meditation, somatic foundation, and then also to really be present with people as a healer. Because when you're doing body work, as you know yourself, with the bone work, that's
Yep.
something where you're really tuning in and working with expanded capacity for discernment, and then using that to really listen to your client or listen to your patient, and then going more deeply with them on a path to healing and health.
Mhm.
So I kind of just started out there in the environment, where like I said,
Mhm.
it was just a different way of being, and
Mhm.
impacted everything.
Yeah, because it's very unusual. I mean, I'm not saying you're the only one, but it's very unusual that a medical doctor would then turn to adding somatic work, to their skill set. I mean, it makes perfect sense to me, as you said, because I do bone therapy, I teach it, I understand that part of it. But what is it that it gave you to add that? What is it that you really got from adding that piece to your knowledge base?
Well, you know, I was always someone who had a very embodied aspect to my life. You know, in high school, I was a wrestler. You know, and
Okay.
it even went back to junior high school. So I spent 6 years, you know, doing sports and wrestling, you know, very physical and one-on-one type of thing. And then when I was in college, I was involved in the theater. And I was very interested in physical approaches to the theater. There was a lot of experimental theater going on, you know, in like the 70s, which I'd read about, and in the 80s, which was kind of my time. And so that physicality in the theater, I did a lot of trainings that were physical. And so then getting into these more integrated modalities where somatics and the body approach to healing just seemed natural from that because I'd always been someone interested in embodiment.
Hmm.
Sort of took off from there.
Yeah. And I mean, it makes sense in the sense that your patients connect more to their body, right? Otherwise, it's sort of they come to you with what's wrong with me. And it's like almost when they're connected to their bodies, it's like it's when they're saying what's wrong and they're connecting all of their body also, not just their heads looking for a diagnosis and being put in some sort of box and some pharmaceutical you know, result. It's they're saying, okay, what else, and you're connecting. I think touch is so significant, like therapeutic touch in that connection and in that assessment of your patient.
That's right. And as you had read, you know, I ended up doing my specialty training in physical medicine and
Mm,
rehabilitation, which really is the science and medical practice of adaptation. You know, that we as beings, as physical beings, you know, that how do we adapt to our environment? How do
right.
we respond in regards to health? How do we respond to the way that we're active in the world? And then even furthermore, I then went on and focused a lot on pain management. And as you know, pain is a bio, psycho, social, spiritual phenomenon.
Mhm.
It's very rare that you know someone comes in with pain that's just a purely physical pain. And you know, for people like that, with some acute pain, it will go away in a week or 2 weeks or something like that. But you know, my practice was filled with people who had had pain that was going on for a lot longer, and you know, it was easy to discern sooner than later that there was more going on than just that someone had a physical injury, and that was what was causing the pain. So that and just the challenges of many pain patients really make you go in and you have to look outside the box because one size does not fit all at all.
Mhm, mhm.
So
Well, let's
more in
talk
that
about
direction. So
pain actually, because that is one of your big focuses. Most people sort of see pain. I guess no, it's not true. Some people do see it all connected. That is, multidimensional. But there are people who really think that it's not like that, that it's if it's hurts in the body, it's in the body. It has nothing to do with your emotional state, nothing to do with your mental outlook, nothing to do with anything else. There's no trigger to it. It's sort of an isolated incident. Um, can you sort of take us on what your journey of understanding, like from where you came from to how you're seeing it today?
sure. Well, like had said, once I started actually getting more into like a medical orientation of things, and being with people in the hospital, you know, it was very easy to see that there were other things going on than just you know the physical response to a surgery or someone's you know oh, I'm sorry about that or you know someone's painful response to a chronic illness or things like that. And you know, just from the most basic level, and today we're much more blessed than ever that we can go and look up information with just you know in a second with the drop of a hat. But something that I think that many people know, and if you don't know it, you'll hear it here. But you know, the same neurotransmitters and the same chemical transmitters in the body that are responsible for pain are also the same neurotransmitters that we're treating for depression and anxiety and post-traumatic stress and all of these other things. So they're the same, the same systems, at least if not all, are partially, involved in such diverse things as, pain versus spirituality. When they're doing, scans and looking at people's blood chemistry when they're in meditation, like it's the same neurotransmitters that are being looked at. So you can see this crossover to many different types of medical conditions, and also as we know, that people are in pain and they're in pain for anything more than a short time. That there'll usually be a psychological component with it, that people are unhappy about it, and they may be in that state for days or weeks or months or whatever.
Mhm.
And the same thing with many medical conditions, as we know, like from Parkinson's disease to stroke or things like that, that these are not just physical manifestations of weakness or tremors or some kind of, just nervous system that phenomenon that goes outside of the mind-body connection. That, there's a very high incidence of depression with Parkinson's disease that we believe is related directly to the Parkinson's disease, and not someone being depressed because they have Parkinson's disease.
Mhm.
And these days we can study those types of things. So even for people who don't want to see things that way, all you got to do now is go online and look up research, and you'll see that there is a lot of high level medical research that supports the fact that the mind, body, and even quote unquote spirit, depending on how you define it, are interconnected even from a biochemical level.
Mhm.
So that by treating one, you can improve the other. We're seeing that also even just with, the more recent topics of like those GLP agonist medicines that
Mhm.
people are taking for weight loss or diabetes. Like so many people are using those medicines now because you can lose, 50 pounds in 10 months and things like that. And I know people have done that. But even with those, we see just so many effects that they're starting to notice, just how the people's level, people's moods are affected by it, and
Mhm.
all kinds of other systems in the body are affected by these different chemicals or transmitters that go through our body. So we're really reinforcing more and more that we are an integrative, like I said, bio, psychosocial, spiritual beings, and that we're
Mhm.
much more complex than than what we think. The fact that we think that we have understood everything about the body or everything about the mind, even including things with AI.
Mhm.
We have evolved over billions of years to be like this. AI has evolved over 40 years, 50 years, at the most 60 or 70 years, and that what we are took billions of years to get to this place. And so the wisdom of the body, mind, spirit, all these capacities that we have, and just the small amount of those capacities that we use for survival, is just nothing compared to the forces that have shaped us. This miracle of life over the billions of years on planet Earth that we have evolved to.
Mhm. Yeah. Well, I have a situation I thought I'd bring up because you'd be the perfect person to ask. And the listeners to this podcast are very aware of it because it's actually my partner uh, who had shingles and ended up with so-called post shingle neuralgia, which happens in 20% of the cases. Usually, it stops in a self-limiting time, and I share, and he shares willingly all of this on the podcast because as my background, I'm a naturopathic doctor. I've used homeopathy, I've used Bowen. We have done everything under the sun. He did take uh, pain pills, which made him extremely sick, very dizzy. Like it didn't last very long. He's not he hasn't taken a lot of synthetic drugs. So that would explain maybe why he's so reactive. Very tuned in person, meditates, has done all kinds of things, has had trauma in his past. And it's a year and a half, and he's still in pain. And so we've been like, what is this on all levels? We've talked to so many people, And, I have a large community of, very gifted, differently abled. We've done acupuncture, whatever. What's your first like thinking of maybe in your experience, what is that link to? What's an avenue? How would a patient like this or his wife um, go seeking other help, other things like, and you can ask what we've done. We've done just about everything under the sun. And so even weird things, like entities. Ayahuasca, I don't find so weird at all, but we've done, many, many different things that could be insightful, opening. Yeah. So any thoughts like this where, because people listening to this program have conditions that they're looking for answers. And they're listening to different people and going, where else could I go? Who do I relate to? What's in alignment with my current understanding of healing and life and everything, right? So I've reached my I don't know stage that let the universe unfold. And then you come along.
Well, I'm wishing I could solve your problem, and what can I tell you? I don't know if that's totally in the cards today, but what I would say, what's important to know that any extreme beliefs that we have, from
Mhm,
whether our beliefs are only in Western medicine and Western modalities, or our
mhm,
beliefs in things that are much less, you know, much less accepted. Really the middle way is the way that you have to go because
mhm,
one is, science is something that has had spectacular discoveries, and now they're happening at a faster and faster breakneck, pace than they ever had. And then, of course, we have all of this wisdom that people have gathered from different cultures and different types of health modalities over thousands and thousands of years that they've been practiced. So it's really, to me, you don't want to rule out or write off anything because each
mhm,
of it is a unique being. And I've been surprised so many times over the years by what helped people get better or have improvement in different conditions that they have. Sometimes
mhm,
it's been really shocking to me, and it's just as I've gotten older, I hope I've gotten wiser. I've certainly become more accepting to things. But what I first recommend, which is what I do myself, is number one is to always make sure that you rule out any of the big things, so that your pain isn't coming from some source that maybe there is a hidden cancer, or there could be some kind of condition that's really a medical condition that's easily treatable. So I always recommend that you go and you get a workup for whatever you have, from the medical doctor or the medical system, whoever your practitioner is, whether it's a nurse or nurse practitioner or a naturopath or whatever, that to rule out, any serious things, because that's really what Western medicine is good at. It's really about being able to rule out the worst things. And that's how the doctor's mind works, is that you want to make sure it's none of these serious things. And then if it's something that's not one of those serious things, or it's something that's life threatening, is really more than saying serious, because I don't want
right.
to make light of what's serious. But any of these life threatening things, that are imminently life threatening, then we can sit back and start to look at, what plan of action to take for people. And so, uh, post-herpetic neuralgia, or, people who have had shingles, post-shingles neuralgia, it's a very painful condition, as you know. My mother had it, and she was miserable for a few years while she had it, near the end of her life. And I've had some friends, who were just being tortured by the pain from this. Some people, it will just burn out on its own after a couple of years, and all of a sudden they'll be pain-free. But
Mhm,
as far as modalities are concerned, it's really a trial and see what happens.
What would your life be like if you were pain free? If you were one of the millions who suffer from chronic pain, the thought of just one day without it may seem impossible. This is often because conventional medicine tends to fall short in the treatment of pain, opting to prescribe pills or recommend surgery rather than getting to the root cause of the problem. But if you are suffering with emotional or physical pain, there is hope. Join the founder and CEO of Bowen College, Manon Bolliger, live online for your body-mind reboot. Learn how to listen to your symptoms and get to the root cause of your pain. Plus, be trained in basic Bowen therapy moves so that you can reboot your body for optimal health. You don't have to live in pain. You can heal. Stop the pain pill cycle by visiting www.yourbodymindreboot.com to learn more and to register.
I don't want
Right.
to say trial and error, but again, that each individual person will have their own response. I had, and I'm just going to go slightly off track from here, but I had some pain that developed in my abdomen and then into my back in 2013. And it was haunting me for like 5, 6 years. And I had done everything. The first thing that I did was I ruled out that it wasn't anything life-threatening. And the good news was that it wasn't. But then secondarily, I was in this miserable pain. And I had tried so many different things, from diet, from different diets and nutrition, to acupuncture, to not just one acupuncturist, but trying different acupuncturists, because you may have two of the most brilliant acupuncturists, and they're both at the top of their field, and their decision making is peerless, and one can help you get better and one may not. And it's not because the one didn't know what they were doing or the one isn't a good practitioner. It's really that at a certain point, it's our own journey and we have to be open-minded and experiment. So those kind of things where it's like, I went to this amazing practitioner in Hawaii and who has a huge reputation, and their acupuncture didn't do anything for me. And then I went to this practitioner in San Francisco and theirs did, and they were, equally good people. So there's a little bit of luck with it, and there's a little bit about, how we are such unique individual beings. And I've studied so many things, and so many of these things that I've studied, I've taken Ayurveda, which I have great respect for. These wisdom medical traditions that have been around for thousands of years have so much to offer. But you give something an amount of time, 6 months, a year. If you're really suffering, maybe you do a switch after some time like that. But you have to be inquisitive and continue to see, what may work for you, because there are so many factors. It's not like we all came from the same cultural background or have, the same genetic background. Especially here in the U.S. where we're such a mix. We have these medical protocols and things that are set up for everybody, and when something is set up for everybody, it's rare that it's going to be able to treat the 30 or 40% of people who don't, fit into that general category, that get better from these things. So I wish I could make it sound easier, but I really think that it's an individual, personal process.
Yeah, no, and that's how we're looking at it. I just wanted to hear your, and I agree, first rule out that it's not something unseen, that it's not the wrong diagnosis. In other words, that it's maybe hiding a tumor or something else, that could be causing similar-ish symptoms,
That's
you
right.
know, and then it's going through, and I totally agree. We've tried different acupuncturists, different homeopaths, different naturopaths, different body works, different, kind of electric, that type of devices. And yeah, it's very interesting. And then you wonder, is the pain from a philosophical perspective its place in your life? Like it's like there are no coincidences, like you're here today on this show. you know I don't think that's a coincidence. I just don't see coincidences anymore. I just feel like an incredible alignment with how things show up. And so why would it be any different in our own healing journey?
That's right. That's right. And with and people's capacity and perception of pain, is affected by so many things that have happened in their life. It depends on what their their childhood was like, what type of home they came from, how pain is regarded in the culture that they came from, because different cultures, there's different perceptions of that. For anybody who's sitting here right now, if I said, let's all focus on our right foot, okay? And if I'm focusing on my right foot now, it's like, my right foot feels different than my left foot when I'm focusing on it. My right foot feels different than the rest of my body when I'm focusing on it. Well, that's an unusual sensation I'm feeling in my right foot. And someone could interpret that as being pain. And I'm not judging that, and I'm not saying that in any way to be humorous or to question people's perception of their pain. But something that feels out of the ordinary and unfamiliar to us, we can perceive in a way that that it is something that is not good for us. And so just because of that diversity of how people perceive pain, one person's pain is not someone else's pain. And that's the difference between like an acute pain and a chronic pain. I have a background, as I had said, in psychedelic therapies, where I've done a lot of formal training through the California Institute of Integral Studies and ketamine-assisted therapies that people do. And one of the amazing things about psychedelics, and this is also in indigenous cultures that practice it, and in cultures where it's not necessarily indigenous, but part of the culture, like in Brazil, where there are medicine churches and things that are totally legitimate, and hundreds of thousands of people are participating in them. That with many of the psychedelic experiences and psychedelic therapies, if you're doing it for therapy, or psychedelic sacraments, if you're doing it through a church, people's pain, all of their pain disappears when I'm on psychedelic. And again, I said that there's a relationship somewhat between neurotransmitters and things like that, but like, what happens, during that situation? What is going on in the body? And we're not sophisticated enough yet to be able to understand, why that neurotransmitter works one way with depression, and what does that neurotransmitter do when it's related to pain, because they're often going through similar pathways. And so again, it at least at the moment, it brings up more questions than it does answers, but I'm also very hopeful for the future, because like I said, research is really both in integrated modalities as well as in Western method modalities. It's going on at a breakneck pace right now.
Yeah, and I mean the fact that it can change, or that one's perception of it shifts, it kind of breaks the illusion that it's like hard and firm and unmovable, and I think that is also the beginning of opening up the possibility that it can go, right? And it's like, I know in my practice I would say, well, even if a symptom would end up coming back, or relapse, how I would call it, it's like, well, your body was able to deal with it, so it knows how to, it's there. We just don't know the right time, exactly how we're going to get there, but it can. And that's the whole thing. That's the possibility, right? So
that's right. And like we were talking about when I was telling you about the pain that I had, which I still have, about 5% of that pain. But back when it came on in 2013, it was very debilitating. I could barely work, and no one had an answer for it. And I had tried so many modalities. And what happened about 3 years in is that one night I was just in agony, and I had some Feldenkrais awareness through movement tapes in my cabinet. This was like, in 2013, that had been in my cabinet since the 80s, right? And I just said, something came to me in like a flash, like, you have a cassette tape in there with those Feldenkrais exercises. Maybe you should try one. And I hadn't done any Feldenkrais, in decades since I was in massage school. And I went and I put in this tape and did, this lesson. And at the end, it was like, did my pain go down like 2%? Because I was just so sensitized to it. And it was just like, this is crazy. Like, could this Feldenkrais exercise have done something that had brought my pain down? And so I started doing these every night. day after day. At this point, I've done, at least 3,000 lessons of this since 2013. Because it's been over. I can't. I bet you I haven't missed 10 days a year. And just this continual opening up to awareness, through movement,
Mhm,
discernment, aware of how my fascial system is
mhm,
integrated through all of my physical being and psychological being, the mind body connection. And I was able to manage that pain down to about 5% of what it was. And now
mhm,
sometimes I'll notice that, like, if I, don't eat right, like if I'll go and have a bunch of French fries or something, I'll feel like a little bit of that. It'll come
mhm,
back. But it's really mysterious because still, when I have workups and things like that, nobody's saying you have a gallbladder problem, or something where it would seem more obvious. And so it's just been, trial and finding what happens with those trials in my own.
mhm. Yeah, and it reminds me of a story. One of my friends that I treated with Bowen therapy, and she was on heavy duty pain medication and really needed to get off it for she had a scoliosis, and we managed to really get her to be almost pain free with doing several Bowen therapy sessions. And then she left, so the country, and I was in touch with her later, and she ended up with another pain that came up, but still the same back, the same curvature, the same everything. And she was able to do it through Feldenkrais.
Mhm.
So you see, it's interesting. She got out of it. And so sometimes it's like different therapies, different moments, different, circumstances. It's very interesting. Like our body wants to heal, I believe. At least that's I think that it's like we're built to heal. And it's a question of finding or aligning ourselves with the right thing at the right moment, you know.
Yes, and like you said, it's sometimes synchronicity
Mhm.
or grace, and I don't mean that in any silly way,
No.
but I know that you don't mean it. It's that there are connections among things that are below the surface of what we pay attention. There's certainly a very powerful subconscious and unconscious that directs a lot of our lives.
Yes.
The more that we can tune in and drop down and focus in that awareness, the richness of the moment, will rise to the surface, and we can get all kinds of new insights and
Mm.
new ideas if we just don't get stuck on those old ways.
No. Well, Jeff, KD Meyers, because you're branding with the KD. You have a show or you have a talk show. What is it you're doing with the KD part?
Well, that's a long story we can share for another time. But that's my nickname is KD,
Okay.
and what I have a few things like. I do have a website called Minute to Mastery, MINUTE number two,
Mhm.
Mastery, MASTERY.com. And that's where I work a lot with peak performance. I work with a lot of professionals, uh,
Mhm.
doctors, lawyers, healthcare professionals, people who are really interested in exploring, their maximum health and from a very open perspective, like we're talking about today. I also have a book that's coming out this fall called Secrets from the Heart of Yoga. I have a long history of yoga practice over the years that has evolved very much. And there's a website for that I'm looking at. I think it's a Jeff KD Meyers, Meyers, MD slash book. Actually, I'm so sorry. I had this written down here. And of course, the moment that I'm getting to give my pitch, I can't find it. But give
Well,
me just
it'll be listed anyways on your, but you go ahead, find it because some people are just listening, so it's better if you.
that's okay. It'll take me just 1 second to hear
Sure.
it. Okay. Yes. It's yes, Jeff KD Meyers MD.com/book. And you'll see that there, and it's called Secrets from the Heart of Yoga. And it's really the book focuses on discernment. And
Mhm.
like what you and I have talked about today, really our ability to drop down and to be present and to, get to befriend that internal awareness that we had that is really a feedback loop that gives us a lot of information about our health. And so it's not a book of yoga postures per se, it's really a book of self-inquiry and how to use yoga as a biopsychosocial spiritual practice.
Great.
And so those are the two main things going on right now.
Okay, well, I think we're going to be talking again, but thank you very much for sharing your wisdom and knowledge with us.
My pleasure. It's been delightful, and you're delightful. So thanks a lot, and until we meet again.
So from the discussion with Jeff KD Meyers, I think for me the big takeaway is it's again connecting to ourselves, to be present enough to be able to hear what we're actually wanting, what direction makes sense. So it's not so much getting our guidance from outside, it's really being your best second opinion, and really toning in what is it that feels right. And so if you're in, receiving a treatment that you feel like you've given it enough time, and it's fair to find out what prognosis the therapist believes it will take. They may say, well, you should see a change. Like, with Bowen therapy, we tell people it's 3 to 5 weeks. After that, if they haven't changed at all, even by the 3rd week, they're probably barking up the wrong tree. There's probably a block. It's probably not right. There's something else that needs to be addressed another way. So it's not that a therapy that works for the right things, which in Bowen can be many things, doesn't mean it works for all people at all times. So, and that's the truth of many therapies. So with chiropractic, I think they say usually, to take at least 10 or 12 treatments, then you'll know. So if you're going that route, don't do 30 of them. If it's not working or not holding or not feeling right to you. Same with physio. Physio works well, but maybe it's not the right time for it. Maybe first you have to kind of re-educate the nervous system, and then you can rehabilitate the muscle. So there's lots of questions, and that's why discernment, really understanding what you're doing and understanding what you don't know. And I kind of brought up the situation with my partner Tony, because we're at the don't know stage, which is really the listening in stage, further listening. Obviously we listen to get this far along, but it's like, what is this journey about? What's it sharing, and obviously it's his journey, but being part of this journey, what is this, what's it kind of for, what are we learning from it? How can we be grateful to it? So there's lots of angles that one can take, and I think, for me, the most important is that change does happen. And with some of the therapies along the way, there has been a brief, but nonetheless a shift, which means the body can shift. And anyway, one didn't need to teach me that. I've learned this now, being in practice for so long. Shift happens, as they say. All right. Thank you for joining us at the Healers Café. If you haven't already done so, please like, comment, and subscribe with notifications on, as I post a new podcast every Wednesday with tons of useful information and tips for natural healing that you won't want to miss.